Lately, I've been getting a lot of ads on my Instagram of $75 or even $65 hormone testing. I'm gonna go over really quickly why that might not be a great option for you in your journey of figuring out why you're having all these perimenopausal symptoms. So first off, those tests are generally blood tests, and blood tests, while they are oftentimes cheaper, they also don't give you a ton of information on why you're having the symptoms that you're having. And that's why I like to use the dried urine testing that Dutch Test offers, because the Dutch Test, it measures the metabolites, which gives you a deeper insight into how those hormones are not only being produced, but also how they're being broken down and eliminated from the body. And that gives you a much better insight into how your liver is working, which is not only important for your hormones, but also for the rest of your body too. And those metabolites, why that's important is because while that estrogen is being broken down, it can be broken down into a more beneficial metabolite or relatively neutral metabolite, or into more active and harmful metabolites like 4-hydroxy or 16-hydroxyestrone. And so that's why it helps you give you a better comprehensive view of that. It also gives you a better comprehensive view of your adrenal health. Oftentimes with blood tests, that's just a snapshot in time of your cortisol, and that doesn't give you a good insight to what your cortisol rhythm should look like. You may be producing too much, you may be producing too little, or you may be producing too much or too little at the wrong periods of time, which is going to impact your hormones significantly. It can also impact your sleep and obviously a whole host of things, because that's an insight into your adrenal health. So if you feel like your hormones are playing a role and your adrenals are playing a role in all your perimenopausal symptoms, then a Dutch test oftentimes can give you a much better insight into all those things. And so the Dutch test will not only show you your hormone levels, it'll also show you how your hormones are being broken down, how they're being converted between each other, if they're being converted efficiently, not efficiently. So overall, not only will the Dutch test show you your hormone levels, but also how those hormones are being broken down and also how they're being converted between each other or not being converted efficiently between each other. At the same time, it's going to give you a good picture into your adrenal health and how stress is playing a role or may not be playing a role in how your hormones are fluctuating and or causing your perimenopausal symptoms. So the Dutch test will not only show you your hormone levels, but it will also show you how you are breaking down those hormones and metabolizing them and eliminating them from the body, and how you're converting those hormones between each other or maybe not converting them well. At the same time, it gives you a good picture into your adrenal health and how stress may or may not be playing a role in your perimenopausal symptoms, which, if you don't know already, stress plays one of the biggest roles in how well you transition into menopause and how smooth that process is. So if you want some more information on this type of testing, as well as some supplements that can help out with this perimenopausal transition, comment perimenopause below and I will send you that info.